Imagine a headache so intense it feels like your head might split open.
And the world becomes unbearable.
This is not just a headache, this is a migraine. What is a migraine? Migraine is a neurological condition characterized by recurring, often debilitating headaches. It's a full-body experience, affecting over 1 billion people globally.
The most common symptoms include throbbing or pulsing pain, usually on one side of the head,
nausea and vomiting,
sensitivity to light, sound, or smells.
Common triggers include stress, hormonal changes, especially in women, certain foods like aged cheese, chocolate, and processed meats, sleep disturbances, too much or too little, environmental factors like bright lights or strong odors. Migraines are believed to result from abnormal brain activity.
Changes in blood flow, inflammation of blood vessels, and a cascade of chemical signals, including serotonin, play a role.
This storm in your brain leads to the intense pain and other symptoms of a migraine attack. Not all headaches are migraines. Common differential diagnoses include tension headaches, often described as a band-like pressure around the head with no nausea or aura.
Cluster headaches, severe, unilateral pain around one eye, often accompanied by tearing and nasal congestion. Sinus headaches, associated with sinus infection symptoms like facial pain, congestion, and fever. Temporal arteritis, inflammation of temporal arteries, presenting with scalp tenderness and jaw pain.
Cervicogenic headache, pain originating from the neck, radiating to the head.
Secondary headaches, caused by underlying issues like brain tumors, infections, or vascular disorders. A thorough medical history and diagnostic tests like imaging can help rule out other causes. Early diagnosis and treatment can significantly improve your quality of life. Thanks for watching.